Thank you for inviting me today. I'm Toshio Inui, CEO of Saisei Mirai in Japan. It's a pleasure to be here to talk to you about the new challenge to cancer and longevity. Today, we have limited time, so I'm going to explain in brief. Introduction to Saisei. Our head office and self-processing center are in Osaka. We have additional clinics in Osaka, Kobe, and Tokyo. We are working with 6 universities in Japan, and actually 4 out of 6 universities are not medical universities because we need the Department of Science, Technology, Veterinary Medicine, and the Pharmacy in order to develop new cancer treatment. Various immunotherapies available at Saisei. We have GC-MAP injection, oral MAP produced from bovine milk, hyper-T-NK cell therapy, autologous cancer vaccine, coli vaccine, dendritic cell therapy, and so many. I'm going to introduce GC-MAP and oral MAP, for which we have worldwide patent. Introduction to GC-MAP. So GC-MAP stands for GC protein-derived macrophage activating factor. I'm going to discuss macrophages and outline the different types of GC-MAP, especially second-generation GC-MAP and exciting oral MAP, I mean crystal MAP and whey MAP that are food products in Japan and Sweden. I'd like to add that we have succeeded in producing recombinant MAP in Japan. So first generation GC-MAP is history now. The image people have of macrophages is that of hungry white blood cells, which engulf bacteria and other pathogens, moving like amoebas. Macrophages are found in essentially all tissues. Macrophages have very important functions, such as phagocytosis of pathogens, removal of dying or dead cells, and scavenging senescent cells and other debris. They play a critical role in adaptive immunity, wound healing, tissue repair, and regeneration. Macrophage phagocytosis. In this video, you can see how macrophages engulf foreign substances using their membrane, like hands. Like this. This is a macrophage engulfing small magnetic beads. And here you can see how a macrophage is extending its membrane to catch a bead. This is called lamellipodia. This is a macrophage activated by GC-MAP. The green color shows actin. As you can see, lamellipodia formation and actin accumulation were observed in just 5 minutes after activation by GC-MAP. And over time, these changes were getting stronger. In this diagram, you can see how macrophages exist in nearly all tissues throughout the body. It includes the brain, the skin, the lungs, the gut, and so on. I'd like to emphasize how important tissue-resident macrophages are in terms of regeneration, repair, regeneration, and rejuvenation of damaged or even normal tissue. One of the principles of medicine is from basic science to clinical practices. I agree. However, clinical facts observed by clinicians are very important. And this time, clinical case report gave me big hints for how stem cells were activated and why telomere length was extended. So first, I'm going to show you some clinical case report in brief. 21-year-old female with alopecia areata, spot baldness. She started taking oral MAF 2 capsules daily. You can see new hair regrowing over a 7-month period taking oral MAF. 12-year-old male with alopecia areata. He started taking MAF 2 capsules daily. And here you can also see his new hair regrowing over a 5 months taking oral MAF. 78-year-old female with hair loss. She started taking oral MAF 2 capsules daily in April 2016. After 1.5 year treatment, you can see her hair regrew a lot. She is 79 years old, looking much younger. 13-year-old female with atopic dermatitis. She started taking oral MAF 2 capsules daily. This is joint of the arm, showing very good improvement with reduced skin redness, reduced scratching, and improvement in skin condition. Neck and shoulder, you can see good improvement here too. This is a patient with psoriasis. She was treated with second generation GCMAF 0.3 milliliter to 0.4 milliliter twice weekly in Germany. You can see very good improvement before treatment and after 6 weeks treatment. 41-year-old patient with light hypersensitivity. UVA light hypersensitivity was detected at Yamaguchi University. Topical steroid and oral prednisolone 5 mg per deciliter didn't work, so he stopped steroid and started taking oral MAF 2 capsules daily. Here you can see a very good improvement over a short period of time. This is a 27-year-old small wrestler. He had a serious injury during small training. Dislocation of right knee joint, peroneal nerve rupture, and ligament tears occurred. He received 2 times surgery without good effect, and he was advised to retire. In March 2017, he started taking oral MAF 6 capsules daily and GCMAF injection daily near the lesion. In just 3 weeks, he felt pain and numbness in his right sole again. In 6 months, with growing muscles and improved movement, he was able to return to small wrestling, but he was suspected to have used illegal drugs by other small wrestlers. Because of his quickly growing muscles, the doping test was of course negative. I'll show you his small wrestling video. This is the patient. Clinical indications for MAF, macrophage activating factor. Initially, we treated cancer patients with GCMAF injection and oral MAF. And later, MAF showed good effects for a wide variety of diseases, especially antibiotics-resistant bacteria, COVID-19, autism, chronic fatigue syndrome. Recently, we have noticed that oranumab is very effective for rejuvenation and even for longevity, for which there were no essential treatments available in the past. I'm going to talk about telomeres. So telomere extension of human telomere for longevity is a dream of all humankind forever. If you can live to be 150 years or even more, looking young and healthy, what would you do? What are telomeres? Telomeres. Telomeres form the end of human chromosomes, like caps. The most important function of telomeres is to protect chromosomes and replicate DNA safely. The roles of telomeres and telomerase. Telomere functions are to protect chromosomes ends from recombination, end-to-end fusion, and degradation, and to maintain chromosome lengths. Telomeres progressively shorten during DNA replication, leading to cell death or senescence. The enzyme telomerase has the capability to extend the telomere end, prolonging cell life and potentially inducing immortality. Telomerase maintains the end of chromosomes, and telomeres are replaced by telomerase, and cells keep dividing. So telomeres shorten, lengthen, and shorten, lengthen. Telomere shortening in aging and cancer. Shortening of telomere in human cells is associated with shortening of life. Telomere shortening limits stem cell function, regeneration, and organ maintenance during aging. Unfortunately, people aged 60 years or older with shorter blood cell telomeres have high mortality rate. For example, they have 3.2-fold higher mortality rate from heart disease, 8.5-fold higher mortality rate from infectious disease, and poor survival overall from aggregate of all causes. Telomere shortening in aging and cancer. Telomere shortening during aging and disease is associated with increasing cancer risk because short telomeres are found in almost all human pre-neoplastic regions. So telomere length can be a good biomarker of cellular aging and cancer. I'm going to talk a little bit more about telomerase. Telomerase is active in stem cells and germ cells, and also detectable in many normal adult cells, and highly active in human cancer cells. I'm going to talk a little bit about DNA methylation. So DNA methylation biomarkers in aging, age-related diseases, and genome instability. Telomere length is affected by both genetic and epigenetic contributions, and aging is not regulated by genes, but also influenced by epigenetics. One type of change of epigenetics called DNA methylation plays a major role to epigenetics and is closely linked to telomere length. Dysfunctional telomeres promote genome instability and cancer in the absence of p53 function. And actually, the acquired gene mutations are most common cause of cancer. Some factors connected to aging and cancer. Generally, it is considered that factors causing telomere shortening are related to oxidative stress, microinflammation, and lifestyle, especially glycation and smoking. This article showed that oral shows very strong anti-inflammatory properties in mice experiments. I'm going to talk about the clinical trial in Japan on longevity using MAP triple. This clinical trial is designed to evaluate the efficacy of oral MAP for the treatment of aging. Secondary objectives are to measure telomere length and to do DNA methylation analysis, including TAT promoter, and age-related gene expression profiling. Population includes adult females and males over the age of 40. Study protocols. 2 capsules of MAP triple are taken per day continuously on an empty stomach. Blood collection is conducted at 0, 3, and 6 months. DNA is extracted from whole blood, and the telomere length is measured by PCR. DNA methylation analysis and age-related gene expression profiling are being done. The current number of the participants was 201 in September 8, 2022. This graph shows telomere length at 0, 3, and 6 months. The number of completed participants is 133. As you can see, the change in telomere length the change in telomere length has an amazing increase. Based on 12-month data, telomere length was extended by 11% at 3 months and by 23% at 6 months. P-value is less than 0.01. This figure shows telomere shortening with age. The horizontal axis shows age, and the blue dot shows telomere length. As you can see, there is a trend of telomere shortening with age in all data at 0, 3, and 6 months. This shows gender difference between women and men. Women seem to have longer telomere length than men at around 4%, which is actually expected. The most important thing is that telomere extension was confirmed in both women and men at 3 and 6 months. Summary and implications. Telomere length was extended with MAP triple by 11% at 3 months and 23% at 6 months in 133 participants. The study agent is named MAP for macrophage activating factor, but clearly it can be named TEF for telomere extending factor. MAP capsules have possible 7 major functions in humans, in my opinion. Telomere extension, which leads to longevity. 2. Macrophage activation. 3. Restoration of dysfunctional tissue-resident macrophages. 4. Stem cell activation. 5. Strong anti-inflammatory properties. 6. Removal of senescent cells. 7. Probably upregulation of telomerase expression of stem cells, even in aged people. So, telomere extensions can reduce cancer risk during aging, and it can also improve tissue renewal and decrease age-related degenerative diseases. Thank you very much for your attention.
Okay, thank you.